Hi, I'm Dr. Shay Corbin with Medical Spine. I'm here to talk to you today just a little bit about the basics of home therapies. I get asked the questions all the time. What's better, ice or heat? When do I do ice? When do I do heat? All those things have some very specific answers, and really it's the one that works best for you. So heat typically is best when we're really stiff, things have kind of been there for a while, and we're trying to loosen up and stretch and do those kind of things. Heat is not baking your skin with the hottest hot pack you can ever imagine. It's shown that lighter heat more frequently is better than a real high intense heat. So if you do a heating pad, don't just let it sit there and heat for 30 minutes or an hour. Let it get kind of good and hot, and then let off the button or turn it off and let it sit there for about 15 minutes. Do that 4 or 5 times a day and you'll get a better result. On ice, we really like ice when an injury just occurs or you have really sharp and burning pain. You can put it right on the area no matter where it's at. And again, multiple times, 10, 15, maximum of 20 minutes is really preferred. So the difference between ice and heat, heat really kind of opens up, brings blood to the area, stretches things, can help really loosen things up for you. Ice calms things down. It decreases inflammation, blood, and all that. So those are just 2 guidelines that you can use. And another really good one is an Epsom salt soak. Just like Grandma said, Epsom salts are really good for you. That magnesium in there, that Epsoms, it really helps pull some of that soreness out. We use it with our athletes all the time. Something else I get asked about is which over-the-counter medicine is best. And the answer is the one that works for you. And there's all these little ins and outs of taking medicines. Best to talk to your primary care provider about that. But yeah, NSAIDs like naproxen sodium, which is Aleve, or ibuprofen, which is Advil, they are often beneficial, usually 2 to 3 days or max. But again, always check with your primary care physician to make sure that it's right for you and you don't have any other medications that may have contraindications for that. Also, stretching. Stretching is something that, am I supposed to stretch when I hurt? Am I not supposed to stretch? Well, stretching is always good for us, no matter what. We always lose elasticity as we age, as injuries come, inflammation comes in there. And so stretching is supposed to be non-painful. If you're feeling pain when you're stretching, burning, stinging, hurting, and you can't hold a conversation as you stretch, then you're really overstretching. Stretching should be comfortable. You should be able to talk to whoever, having just a normal conversation just like we are now. And you always want to hold for at least 15 seconds up to 30 seconds. 20 is usually really good. And again, 2, 3, 4 times in a row with a little bit of rest in between. If you have any other questions, feel free to contact us.